factors. And so what we did find was a consistent but quite a small reduction in left ventricular ejection fraction. And this is what we would consider not very or not clinically significant. And that's also sort of supported by the fact that we didn't see changes in our other markers of ventricular function in global longitudinal strain and a blood marker of ventricular stress. And then the other interesting finding was that in those who exercised, we saw a non-significant trend towards a blunted increase in a marker called troponin, which is a measure of heart muscle damage. However, we certainly need to take this into context based on the selection bias, obviously, between two of our groups. And so if I could finish with some of our key messages, I think the first thing we really need to acknowledge is that in those patients who don't exercise during their chemotherapy, we see a very substantial reduction in their functional capacity that really supports this accelerated ageing process. And this left 1/3 of our cohort with quite significant functional disability that also has important prognostic significance. Now, unfortunately, this couldn't be explained by resting measures of cardiac function. However, and contrary to our belief, this wasn't either explained by our heart function measurement during exercise, suggesting that there are other factors at play contributing to functional decline following chemotherapy. However, the good news is that we can use a systemic treatment such as exercise to counteract the systemic effects of chemotherapy, at least in regards to functional capacity. However, I think we're still left with a number of quite important questions, and these primarily relate to the fact that this was really designed as a pilot study to inform future work. And so we've actually just started a new and larger study that aims to recruit 100 breast cancer patients where they'll actually be randomised to exercise training or usual care. And we're looking to actually try and capture some of the negative effects of the chemotherapy on these other organ systems so we can better understand exactly how it's having an impact on these patients. And then the last thing that I sort of briefly mentioned previously was that we've only really got a picture of what happens during those immediate months of chemotherapy. And to really understand what these things mean, we need to track these patients out over a longer period of time. And so we're actually in our new study trying to track these patients out over a 12-month period to see whether there's any recovery or maintenance or perhaps a continued decline in these measures. So obviously a number of big acknowledgements to our research team and our funding bodies, but particularly all of the collaborating hospital sites and in particular two of our key referrers who are Yola Nantil and Sophie Nightingale. And of course all of our 28 absolutely fantastic participants as well. And thank you all for listening.
Thanks, Steve. I don't think I'm alone in thinking that was a wonderful presentation. We've got a minute or two for questions. No?
Great, thank you. So you mentioned that there are some other factors that have to be involved. Any idea what they might be?
And that's an absolutely fantastic question, and that's really got us thinking. The most likely factor we feel is at play is skeletal muscle. And this is not unsurprising because when we look at a host of different chronic diseases, including heart failure patients, patients with lung disease, we find that skeletal muscle contributes at least half of the impairment in some cases in their exercise capacity. And so whilst their heart's delivering the same amount of oxygen in this case, based on our cardiac output, the skeletal muscle just cannot utilise it as effectively. And I still think that's of important prognostic significance because we look at individuals with sarcopenia and even individuals with heart failure. Those who have worse functioning muscle tend to have much poorer outcomes. So that's why we're very interested in looking into this further.
Just following on from that, doesn't the fact, I'm obviously not a cardiologist, but doesn't the fact that you've got an increased heart rate and decreased ejection fraction mean that the heart is struggling?
Yes, yeah, but just not, at least sort of interpreting the contributions of VO2, just because that cardiac output was maintained, it's a little bit confusing as to exactly what's contributing, but there's definitely something to explore there.
So if there are no other questions, we might move on to our next speaker. Thanks very much.
Thank you.